Hello everybody. Good morning. My name is Aditi Someshwar. Now I am studying in MSc BT first year. Today I am going to talk to you about my presentation. My presentation topic is monoclonal antibody. Firstly, we know the antibody. Antibody is also known as immunoglobulin Ig, a large Y-shaped protein used by the immune system to identify and neutralize the foreign objects such as pathogenic bacteria and viruses. The antibody recognizes unique molecule of pathogen. Unique molecule of pathogen is called as antigen. There are two types of monoclonal antibody. There are two types of antibody, that is monoclonal antibody and second is polyclonal antibody. But today we will present or talk to you about monoclonal antibody. So in that monoclonal antibody, I will take 5-6 main points in that monoclonal antibody. We will study it. Firstly, objective in that monoclonal antibody, hybridoma technology, procedure of hybridoma technology, application of monoclonal antibodies, and side effects of monoclonal antibody. We will take first slide of this presentation is the discovery of monoclonal antibody. Discovery. Monoclonal antibody were produced in mice using a technique described by Kohler and Michel. Kohler and Michel was coined the term or described monoclonal antibodies. They are awarded the Nobel Prize in 1984 for their work. Nobel Prize in Medicine and Physiology was awarded to Kohler and Michel and Journey in 1984. Then we will take second slide. What is monoclonal antibodies? A monoclonal antibody is an antibody made by cloning a unique white blood cell, basically produced by white blood cell, which is called as plasma cell, It is used to treatment of cancerous cells and anti-venom, anti-snake venom, and we will study the next point is hybridoma technology. In that 5 to 6 steps in hybridoma technology or methods is used in hybridoma technology. That is, first is immunization of a cell, second isolation of B cell from the spleen, third is cultivation of myeloma cell, fourth is fusion of myeloma cell and B cells, and fifth is multiplication of cells by in vitro and in vivo, and sixth and last is harvesting. Firstly, we know the hybridoma technology. Or what is hybridoma technology? Monoclonal antibodies can be produced in specialized cells through the monoclonal antibodies can be produced in specialized cell through a technique. That technique is known as hybridoma technology. Hybridoma technology is method for producing large number of identical antibodies. First step of procedure or first step of hybridoma technology is immunization of a mouse. The antigen against which the antibody are produced inject in selected animal. B cell convert into plasma cell. Plasma cell are produced monoclonal antibodies. Monoclonal plasma cell are produced monoclonal antibodies. And next step is isolation of B cells. Spleen is collected through that animal and collected, and plasma cells are isolated. Myeloma cells are cultivated in bone marrow. They should not produce antibodies. Myeloma cells should not produce antibodies, and they cultivated in bone marrow. In that slide, figure of mouse and procedure for the hybridoma technology. In that figure, mouse firstly we take mouse with antigen, then collect the spleen cells and fusion of spleen cell and myeloma cell in fusion in we use polyethylene glycol for fusion of my spleen cell and myeloma cell, then produce hybridomas, and in culture in het medium select for positive cell. Het means hypoxanthine aminoprotein thymidine medium, and then harvested monoclonal antibodies. In vivo and in vitro. In that second slide, diagram of that procedure of monoclonal antibodies produced. In that antigen is inject to that animal, that is mouse animal. We will collect the spleen cells, antibody producing cells, and then myeloma cell and spleen cell fusion with polyethylene glycol fusion, fused cells, hybridoma cells will be produced per cells, and antibody produced in culture supernatant and antibody produced in mouse acylated fluid. In next step of fusion of myeloma cell and B cell, it can be done using electrofusion or polyethylene glycol. Used to polyethylene glycol. 5 different type of cell are produced, that is fused plasma and myeloma, hybridoma, unfused plasma and unfused myeloma. 5 different type of cell are produced. Selection of cell line, it is carried out in het medium, hypoxanthine aminoprotein thymidine medium. Nucleotide can be synthesized by 2 ways, salvage pathway and de novo pathway for cell division. As aminoprotein in the media, it blocks the key enzyme dihydrofolate reductase, so de novo synthesis can not follow. To operate the salvage pathway, cell must have HGPRT, hypoxanthine guanine phosphoribosyl transferase enzyme, and also have hypoxanthine and thymidine as a precursor, and harvested antibodies from the culture supernatant. Then we will take next slide. In that slide, hybridoma technology. In 9 step we will study. Firstly, a mouse is inoculated with antigen to which the monoclonal antibodies are to be produced. After this, spleen is removed and fused with myeloma cells, and in order to produce hybridomas that will be selected according to the antibody produced. And thirdly, we will take next slide. Application of monoclonal antibodies is used for early detection of pregnancy, detection of treatment of cancer, detection and treatment of cancer, early detection of pregnancy, detect allergies and viral diseases, diagnosis of leprosy, treatment of autoimmune diseases like HIV, AIDS, and side effect of monoclonal antibodies. Some common side effects include dizziness, headache, allergies, diarrhea, cough, fever, itching, back pain, general weakness, loss of appetite, insomnia, and constipation. And among the possible serious side effect is bleeding, arterial and venous blood clots, autoimmune thyroiditis, hypothyroidism, hepatitis, heart failure, cancer, anemia, and diseases decreases in white blood cell, and that causes the cancer. High and high increases in white blood cell uh, causes the cancer. If any question, we will you ask me. And thank you so much for listening my to my presentation. Thank you so much.